call this meeting to order at 9 o'clock a.m. You can join today's board meeting via phone. Dial 971-254-3149, conference ID 736-023-979#. Audio capabilities are listen only and are offered on the best effort for the public. Our meeting is also live streamed, and you can join us by going online to tctvonline.com and click on live broadcast. Before we get started, I'd like to remind everyone to mute their phone. You can do this by pressing *6. Please unmute your phone when your agenda item is ready to be discussed. For those joining via computer, please unmute your microphone and turn on your camera when your agenda item is called. All others must remain muted with their cameras turned off. Thank you. Public comment. Those intending to provide public comment to the board may email submissions to publiccomments@co.tillamook.or.us. Public comments received by 12 p.m. on Tuesday will be distributed to the board, posted online before the meeting, and become part of the public record. Public comments can also be mailed to the Board of Commissioners Office, 201 Laurel Avenue, Tillamook, Oregon 97141. Okay, we have already called this meeting to order, so I would like to welcome everyone and request anyone in the room to please sign the guest list. If you've not done so, it's in the alcove to the right as you come in. And we will begin with our Pledge of Allegiance. Commissioner Bell, will you lead us?
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay, so our first topic will be public comments. Do we have anyone that would like to make a public comment today? Do we have anyone online? Okay. Then we will, and we have no non-agenda items this morning. All right, we'll move right into our agenda. Okay, so we will be postponing. Can somebody tell me quickly what number that is?
Item number 12.
What? Item number 12, thank you. So we will be postponing item number 12. Okay, great. So we will start with item number 5, which is our consent calendar, which is new outlet and limited on-premise sales liquor license application for Doryland Pizza. And I believe for these, we just go ahead and do a motion to approve the consent calendar.
Madam Chair, I move to approve the consent calendar as presented.
We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Thank you. Okay, moving into our legislative administrative agenda. We have a discussion and consideration of a resolution in the matter of proclaiming 2023 as a year of celebrating Adventist Health Tillamook and its 50 years of caring for Tillamook County. And we have with us this morning Eric Swanson, the president of Adventist Health, and I think we have a few other folks as well. Eric, would you and or the representation like to step to the front table? And this is an exciting piece for us. I think having Adventist Health in our community for 50 years doing amazing things, but I will let you talk a little bit more about that.
So thank you, Commissioner. It's good to be here today. This is John Hay. John is our communications manager. I am excited about 2023 for Adventist Health. For those of you who remember my story, Adventist Health took over the hospital, the management of the hospital in July of '73. And my mother, actually August of '73, and my mom was one of the first professionals recruited, and so we landed here on Labor Day weekend in September of '73, and I've been here ever since. And so we absolutely love serving the Tillamook community. And so we're asking for this proclamation to start off our year of celebration, and we have a long list of things that we're going to be doing this year to commemorate and celebrate the last 50 years that we have served this community.
Wonderful, thank you. Commissioners, do you have questions or comments for Eric? And I'll let you start, Commissioner Bell. I know you have a history of Adventist Health.
I do have a history with Adventist Health. I am delighted to proclaim the official proclamation is 2023 is a year of celebrating Adventist Health in Tillamook and its 50 years of caring for the community. I feel like We are very fortunate in Tillamook County to have Adventist Health as healthcare providers and partners, and I'm just, I feel grateful. I feel grateful. I know that other rural communities struggle to provide services to their citizens, and Adventist Health does an extraordinary job, not only with the hospital, but also the clinics and the ambulance service, and I just think it's wonderful. So thank you so much.
Thank you.
I concur completely with Commissioner Bell. Adventist Health is just doing a great job, terrific job. The number of new doctors and professionals that we brought into Tillamook County is absolutely incredible. There's no reason to go outside of the county for healthcare. There's just not, which is terrific. And for a small community like ours, which has more cows than people, that is quite an accomplishment. And Adventist Health, all your employees, all your management, all the way up to Roseville, where your offices are now. But we're doing such a terrific job for the residents of Tillamook County. We really do appreciate it.
Thank you. And I would echo everything my fellow commissioners have said. Having Adventist Health in our community is really phenomenal when you think about how small Tillamook County really is, to have a hospital here, to have the number of medical services, the partnerships that you have brought to Tillamook County with OHSU, just really bringing in specialists on a regular basis. You know, people can live here and not have to travel over the hill for so many services. It's just phenomenal. So I grew up in Maupin, and so we had no medical care for 43 miles. You had to make it to the Dalles, and you had to get your medical care there. And I will just say, raising my daughter here, actually being able to give birth to my daughter here and raising her here while my sister was raising her two children in Maupin, and how many times she said, oh, somebody, Eli had an ear infection, we had to drive to the Dalles at 11:30 last night. Where for me, I was able to just pop down the street and get the care I needed, very local. So it is amazing. The other thing I think that, we have so many visitors to Tillamook County. We have so many different trauma accidents related to Sand Lake and vehicle accidents, and we have trauma surgeons here that do amazing work. So I think that just the breadth of what Adventist Health provides to us, from our daily medical care at the plaza all the way into those very high-level trauma cases, and then you can have your knee or your hip replaced. We have that orthopedic capability here as well, so you can get cancer treatment here. I mean, it's just amazing when you think about the size of our communities and what's offered, and I know you all have worked very hard to make that so. I know that it is not an easy financial world right now for our healthcare providers, and specifically our hospitals, and we just appreciate that you are here doing the great work that you're doing.
Thank you.
So do you want to read that proclamation into the record as your motion?
I'd be more than happy to.
Wonderful.
Madam Chair, in the matter of proclaiming 2023 as the year of celebrating Adventist Health, Tillamook and its Adventist Health Tillamook and its 50 years of caring for Tillamook County. This is resolution number R-23-02. 1. On August 15, 1973, Northwest Medical Foundation of Tillamook, a wholly owned subsidiary of Adventist Health, filed for nonprofit status to operate Tillamook County General Hospital. 2. 50 years later, in 2023, Adventist Health Tillamook is committed to its vision of transforming the health experience of its community by improving health, enhancing interactions, and making care more accessible. 3. Adventist Health Tillamook performs its vision through a 25-bed critical access Level 4 trauma medical center with 5 rural health clinics in Tillamook County, responding to 5,000 plus ambulance calls and providing care to 10,000 plus emergency patients, 10,000 plus urgent care patients, 80,000 plus medical office patients, performing 1,400 plus medical procedures, and 120 plus baby deliveries. A lot of pluses right there. 4, Adventist Health Tillamook employs 470 associates and 45 medical providers, and is one of the largest employers in Tillamook County, providing over $3 million in community benefits in 2021, including in-kind and financial donations to feeding the homeless, community health development and education, and many community organizations. 5, Adventist Health Tillamook celebrates the support of the community as a dedicated healthcare partner towards the mutual benefits that come with reliable, high quality, and compassionate healthcare. 6, on the 50th anniversary of Adventist Health Tillamook, Tillamook County celebrates its mission-driven staff, physicians, and volunteers who selflessly care for our community. 7, Tillamook County looks forward to the bright future of healthcare as a point of community pride, known for its high quality on the Oregon coast. And 8, now, therefore, it is hereby resolved that 8, the Tillamook County Board of Commissioners do hereby proclaim 2023 as a year of celebrating Adventist Health Tillamook in its 50 years of caring for Tillamook County. I will move it through.
Wonderful. We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Thank you so much.
Thank you very much.
Okay. Moving on to agenda item number 7, discussion and consideration of an order in the matter of the appointment and reappointment of members to the Tillamook County Wellness Advisory Committee. We have Michelle Yank, the Director of Wellbeing Adventist Health, with us today. Good morning, Michelle.
Good morning.
Good morning.
Thank you so much for having me. As you just said, I'm Michelle Yank. I'm Director of Wellbeing at Adventist Health Tillamook, and since 2016, I've been serving as the coordinator for Tillamook County Wellness, our local population health improvement initiative for Tillamook County. I just want to remind everyone that this is a program of Tillamook County Public Health, and our backbone agency is Tillamook County Community Health Centers. I see that Marlene Putman is on this call this morning, and I just want to thank her for her leadership and providing the backbone function for our wellness initiative all these years. It's been integral. We've had a number of staff members of Tillamook County Community Health Centers over many years, including AmeriCorps Vistas and public health program representatives who have really kept the wheels on this bus. So I just really want to emphasize and thank all of those contributions. But this wouldn't be possible without the leadership of our stakeholders and our leaders in the community. I'm excited to announce that we have expanded the scope of Tillamook County Wellness. In the past, it has been primarily focused, it is still focused on the prevention of type 2 diabetes. In the past, the action areas that we were working toward that goal were directed at preventing chronic disease in general, and a little bit more exclusively oriented toward lifestyle and patient supports to that end. Every 3 years, our organization, Tillamook County Community Health Centers, and our other partner healthcare agencies in the community, Tillamook Family Counseling Center, Reinhardt Clinic now, the Nehalem Bay Health Center and Pharmacy, and our partners at the Columbia Pacific CCO. We're all obligated by the federal government and state government to reinvest energy and resources into the community in the form of community benefit to improve health, in addition to treating disease as it is occurring in our communities. And progressively, actually beginning with the leadership of Eric Swanson and Marlene Putman, we have been working more and more collectively toward that goal. We have a triennial data collection process called a Community Health Needs Assessment that we've done, and progressively we've done collaboratively. And now this is the first iteration of that we're now more intentionally addressing the Community Health Improvement Plan as a collaborative effort. So the advisory committee members that we are being appointed in this board order today, that's become their purview. It's expanded in scope to encompass the improvement of community health priorities as identified in our Community Health Needs Assessment. And those priorities for this 3-year period are addressing housing, barriers to access to care, and improving financial stability for community members. So it still encompasses all the existing work. Nothing is going away that we've been doing. And not everything that happens in those areas are being done by this advisory body or the committees. A lot of that work is happening already in other forums. We've got many groups working toward improving these areas of concern. Specifically, the Tillamook County Housing Commission is working obviously very closely on improving our workforce housing, which is also going to help us address rental stability. So there's a lot of overlap, and those stakeholders are part of this appointed body that we're bringing before you today. So with that, I would like to begin by saying and thanking members that are stepping down, many of which are being replaced by alternates to represent their organizations. And I would like to take the liberty to mention the organizations that these folks are serving, just to bring to attention who all is represented in our advisory capacity. So I want to thank Joelle Archibald, who has served us as an Oregon Health Authority innovation agent for the Oregon Health Authority. She has stepped down, and Getsy from the Oregon Dairy Nutrition Council has stepped down and is being replaced by Lewis Martin. Our representative, Suzanne Weber, technically she's still on it, but I'm not sure she's pretty busy now, so we're going to give her a pass on a formal voting appointment, but we do expect to see her from time to time. She's still very supportive and involved in our work. Stephen Blakesley, our regional research liaison with Oregon Health and Science University, OHSU, has stepped down. He was really integral in getting us started in all of this, and he has a replacement who will be appointed today, Kayla Warner. And then Paul Snyder from Tillamook County Creamery Association is stepping down but being replaced by Abby Carroll from the same organization. So I thank them for their service. And I'll go ahead and read the names and organizations of those that are either continuing to serve or, as I mentioned, have been replaced. So Frank Hanna Williams with Tillamook Family Counseling Center. Kaylin Cisco, who's here with us today and has been an appointed member of this body since its inception, and we really appreciate our relationship with the YMCA. Laura Swanson with Tillamook County Pioneer, Marlene Putman, Tillamook County Community Health Centers, myself. Dusty Linnell with OSU Extension. Heather Overs with the Columbia Pacific CCO. Jennifer Garcello with Tillamook Tillamook School District 9. Lauren Sorg, Food Roots. Dondi Corintas with North County Recreation District. Eric Swanson with Adventist Health Tillamook, and Nicole Bertner as his alternate. Ross Tomlin with Tillamook Bay Community College, and Joanne Critelli as his alternate. And we are pleased to add Gail Nelson with Nehalem Bay Health Center and Pharmacy. Thomas Fiorelli, or TJ Fiorelli as we know him, with the Department of Community Development, and specifically as our housing coordinator, since that is the body of work he is overseeing and will be a very important piece to this new scope. And as I mentioned, Abby Carroll with Tillamook County Creamery Association, Kayla Warner with OHSU, and Lewis Martin with the Oregon Dairy Nutrition Council. And then I just want to also thank all of those. I see several names in today's meeting that are with the county or other organizations that are supporting our efforts by volunteering on committees and being ad hoc members on our advisory stakeholder panels. So just thanks to everyone that's making this possible.
Thank you, Michelle. Did you have questions about it?
Thank you very much for the work that you do. Thanks to the folks who have served and to the new folks who are joining. I think this work is really important. I'm particularly excited about the community health needs assessment this year, which I think is very innovative and forward thinking. I appreciate in particular that it includes financial health and stability and housing as primary health concerns, which, you know, now that you've said it in public, it seems obvious, but I don't think that it's been in community health needs assessments previously, at least not in my experience. And I think it's it makes perfect sense. And I really love the holistic approach to health, which I think Adventist Health models and embraces, and I think that all the work that we'll do to address those three issues, financial health and stability, housing, and access to care, we have the real possibility of changing people's lives. And so I'm grateful for the work and for everyone who's participating. Thank you.
And thank you for your leadership as our board liaison.
You're welcome.
This all started many years ago, kind of with former Commissioner Bill Bartline and many others that were involved in this process. This was the year of wellness. It's gone past 1 year, and it's going even stronger than it ever has. The list of board members that you have now, I mean, it's a who's who of Tillamook County and beyond, which is terrific. So this has taken on a life of its own. It has, and it's never going to stop at this point. It's just going to keep going. And Michelle, we appreciate all the energy and time and patience that you put into this organization. It's terrific. It's come a long ways, doing very important work for the residents of Tillamook County, and I just feel there is a lot more to come at the same time. Thank you.
Yeah, and thank you, Michelle. This is wonderful, and you know, having that combined community health assessment, I think is one of the most amazing things that our community has done. You know, I remember the days of having multiple assessments. Each agency did one, and as a director at CARE, I was always asked questions by each agency about those social determinants of health and, you know, how they played in, and they were always a subline, you know, to the assessment. So I think just the evolution of this process is amazing, and then to move it into the implementation of the advisory body into this wellness world just really speaks to kind of the evolution as well, recognizing that health is so much more than your physical health alone, and recognizing that what impacts your physical health is so much more than just your physical body, right? It's that zip code is far more impactful in how your health will play out in your lifetime than your genetics. And that really speaks to those social determinants of health that in this particular plan have really been highlighted, you know, with housing, with financial stability and access to care. So it's a great focus. It's a challenging focus. It's how do you take something that's intended to be healthcare based and really shift it in an intentional way toward those social determinants of health. And you all are doing that work, and the wellness is an amazing place for it. So I thank you for that. I thank you for your leadership, for your willingness and ability to say, wow, how do we do this so that we can tie into the good work that's happening in the community and build upon it rather than creating a whole new committee that's going to duplicate something. This just is it makes so much sense, and I appreciate that very much.
Madam Chair, I think we're ready for a motion.
I think we are as well.
Before I make a motion, I just want to, again, thank Michelle. You've got your hands full, especially with people like Kalen Cisco. He's going to keep you very busy. He will. We love Kalen.
I know how to leverage energy like Caitlin.
There you go. He does. Madam Chair, in the matter of the appointment and reappointment of members to the Tillamook County Wellness Advisory Committee, order number 23-005, I would move approval.
We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Thank you very much. Okay. Moving on to item number 8 on our agenda, discussion and consideration of an 11th amendment to Oregon Health Authority 2021 to 2023 intergovernmental agreement number 169528 for the financing of public health services. We have Marlene Putman, Administrator of Health and Human Services, with us this morning. Good morning, Marlene.
Good morning, and good morning. I don't know if Michelle and Eric are still here or if they already left, but I just wanted to say thanks again. I so appreciate that partnership.
Eric was walking out, but he turned around when you called his name.
Yes.
So he says hello.
Thank you.
Thank you both.
Thank you.
Thank you for being here.
And for Michelle, like, providing that item today, I just did not have that capacity with our all-staff meeting happening too. So this item is another amendment of the 11th amendment of our agreement with the Oregon Health Authority you'll see on attachment A that this is a revision to remove funding that wasn't expended during the specific time frame of the biennium under two program elements, 10 and 13. We'll likely see some of these funds back in the next amendment because they weren't expended within the 6/30/2022 budget. So I'm just pointing those out there, yeah, on attachment A under, probably 9 and 11, items 9 and 11 on that sheet, which you can reference. This has been reviewed per normal process, so we're just looking for your approval today.
Thank you. Questions or concerns, Commissioner?
Nope.
Question, well, no, neither actually, but considering we've gone a year and a half and we're only up to the 11th amendment, I think that's not bad. I do remember during the high tide of COVID and the pandemic, we were having many more amendments. So slow down just a little bit.
That's good news. That's good. Okay, as is typical, these amendments just keep coming as you
They do.
mentioned, so I think we're ready for a motion then.
Madam Chair, in consideration of an 11th amendment to the Oregon Health Authority 2021-2023 Intergovernmental Agreement number 169528 for the financing of public health services, I would move approval.
And a second.
We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Thank you.
Thank you, Marlene.
Okay, moving on to item number 9, also with Marlene. Discussion and consideration of a professional services agreement number 22/23-012 with Smile Studio for the Federally Qualified Health Center, FQHC, Oregon Health Plan, Medicaid, and non-insured dental services.
Yes, so this might sound familiar because we talked about our arrangement or agreements with local dental providers recently. This is our new annual agreement today with the Smile Studio and Dr. Lee Long's team there, who we've been working with for a number of years to assist in providing services for Medicaid and uninsured populations. So I think I mentioned before, but I'll try to do a shorter version this time. Tillamook County and our community health centers and the dental service that we provide can't cover all of the 5,000 or 6,000 people that are assigned to us with our one dentist and hygienist. So we work with wonderful dentists in our community to assist in providing services to that population at the fee rate that we're able to receive, as a sliding fee also from minimum cost to our clients. So we appreciate the Smile Studio entering into an agreement again for a year from January 1 of 2023 through December 31 of 2023. And we use a formatted fee agreement that ranges based on the number of patients served. So you'll see a flat fee and then a scale, like up to 65 patients, over 65 patients, to 100 patients, and so forth. So they agree to receive reimbursement at a lower rate than they would normally receive, obviously, with private insurance and that kind of reimbursement. So we appreciate their willingness to help our community and people in need. And this is our agreement that's, again, been reviewed by legal counsel and for your consideration today and approval.
Thank you, Marlene. Questions, concerns, comments?
Just the comment that I'm grateful for our dental healthcare providers and for the service they provide to our community. It's really, it's a huge benefit to the health of our community.
Agreed. Commissioner?
I would concur. Oftentimes people, not often enough, people don't consider dental care when it comes to the overall physical health of a person. And yet dental health is extremely important. You certainly can't live a good life, and dental health also affects other systems within the body. So Marlene, I know you've done just a ton of work bringing true dental health for under and uninsured community members in this county, and appreciate it so much.
Perfect, thank you. And I echo my fellow commissioners' comments. I remember when I first moved here and started working, with care, just the lack of dental care that was available for low-income folks. And this expansion by starting your own dental clinic there as part of the Federally Qualified Health Center, as well as these continuing relationships and expansion with our local dentists to make sure that need is met is phenomenal. So I really thank you for that.
Okay, ready for a motion?
I am.
Madam Chair, in consideration of the professional services agreement number 22/23-012 with Smile Studio for Federally Qualified Health Center, Oregon Health Plan, Medicaid, and non-insured dental services, I would move approval.
We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye, motion carries. Thank you. Okay, moving on to item number 10, discussion and consideration of a grant application to the National Alliance of State and Territorial AIDS Directors, NASTAD, for strengthening syringe services programs capacity through direct program funding. Marlene is with us, but we also have Rachel Kolczewski, our public health program representative, I believe.
Yes. I'm not sure if Rachel has her camera on or not. I'll try to provide an overview. Rachel is our harm reduction lead, and so this is what we're looking at is an opportunity to expand our services and to also get some stable funding. I know there's been discussion in our opioid use risk reduction project. There's been discussion about using the opioid settlement funds to stabilize and or expand harm reduction services. But if we can also get other resources, that would allow us to leverage and extend those funds that come to the county for opioid use risk reduction. So this proposal is to fund a full-time FTE for harm reduction. Rachel's position is the lead, and part of her position covers this, but we provide that funding primarily from patient-generated revenue, from the clinic, and from little grants here and there to help support that. So we're hoping that this would allow us to, at least for a year or two, again, if awarded, to stabilize that and also to expand some community health worker outreach and train folks to do that as part of a FTE also. And then there's also on our list of budget up to 150, but I think our target now is around 125, 130, to provide supplies, to provide those things that are needed at our harm reduction events, which can include such things as, even blankets or food or a hot meal at the time that they're visiting, supplies for wound care, etc. We do receive some grant funding also for direct supplies. So we're only using in this grant those that aren't covered by one of our other grants to support this project. And Rachel, if you would like to speak just briefly about how the harm reduction projects work right now in terms of like a typical Wednesday, just to talk about how that works and how this project would support our expansion of those services. She has a dream, as she says. So go ahead, Rachel, if you're comfortable.
I'm not seeing her unless she's on the telephone, perhaps. Which, Rachel, if you're on the telephone, it is *6 to unmute.
Oh, if she's not.
Yeah, it looks like
May not be
she's
with
not
us.
with us this morning.
Okay, so we were talking about this yesterday, and what she would really would like to see in terms of the project when we talked about it was to be able to have meals, but also to have some additional outreach, not just to the one-day event that we have, but also some referral resources and support, some staff that are able to assist people, transportation and otherwise, to get to a mobile, for example, medication-assisted treatment or therapy, and to look at those resources and partnerships we have with Adventist Health and with Neyland Bay to be able to do some more community-based or field work-based service and support for engagement in substance use and opioid use services. So we're hopeful. This is due the end of the month, and we're in the process of working on it, and we're looking for your approval to apply.
Wonderful, thank you. Questions, comments, concerns?
I'm grateful for this work. I'm hopeful for your grant application. I think it's very important work. We all wish that drug addiction wasn't so prevalent in our community, and that IV drug use was also not prevalent, but because it is, harm reduction, I think, is an excellent approach. It's an excellent program. You know, specifically the reduction of harm in terms of spreading of AIDS, HIV, and hepatitis C, et cetera. And also I like the approach that that when people come to receive the services, that they also, it's also an opportunity for connection and to talk to people about if they want more help, if they want a program, if they want to stop using drugs. So you know, I think it's a compassionate and also pragmatic approach to reducing disease in our community. So thank you.
Marlene, I appreciate that last sentence that you had. So you are still working on the application. We do not have the application in front of us with a signature on it. So you're just asking for us to approve you continuing to work on the application for submission before the end of this month, correct?
Correct.
Okay, perfect. So I have no questions. I'm in support.
Wonderful. Thank you, and I agree with everything Commissioner Bell said. This is unfortunately a very difficult time in the world, and the pandemic did not help. We have seen increasing rates of substance use disorder, opioid use disorder, and I don't know if people realize, but when you are addicted to opioids and you can't get them, the fallback, the place that people go next is heroin, because it has a very similar response in the body. And I think when we think about heroin, we typically think about someone on the street who's non-functional, but I don't know that people realize how many people are working, they have families, they have lives, but because of being pulled off of opioids, they have gone to illegal drugs to continue to function. And heroin is one of those. And the needle exchange is so, so important as people really work to figure out how they're going to get off of all of that and to get the medical help they need. So, you know, this is such an important program in our community and across the nation. So I really appreciate the work. I appreciate Rachel so much. I'm sorry she's not with us this morning. She is, we joked about Kaylin's energy, but if you haven't had a chance to visit with Rachel and talk with her about the harm reduction work, that energy, that passion, it just comes flying through. She really is committed to this work, and it's hard work. And I want her to know how much we appreciate her. She is one of those people that whatever is asked of her, she says, yes, I can do that. So just appreciate her very much. So I think we are ready for a motion.
Madam Chair, in consideration of a grant application to the National Alliance of State and Territorial AIDS Directors, NASTAD, for strengthening syringe services programs capacity through direct program funding, I would move approval.
I second.
We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Thank you. Okay, thank you, Marlene.
Thank you, and I'll share your kind words with Rachel.
Thank you. Okay, item number 11, discussion and consideration of a professional services agreement with Camp Creek Electric for electric design and engineering for the Pacific City Transfer Station. We have David McCall, our solid waste program manager, with us this morning, I believe.
Yes, good morning, Commissioners.
Good morning, David.
So we've had a couple different agreements with regard to the Pacific City Transfer Station and our plans and things moving forward there with the expansion and improvements. You have already approved the contracts with the design engineers, the structural engineers, and this is the electrical engineering portion of it. So hopefully this is the final kind of planning and engineering contract that I will be presenting to you, and next time that I come to you about this project, it will be with bid results for or maybe with the forgivable loan agreement that we'll have in place by then. But so this is just kind of the final planning and engineering element of this process. So I'll also give you an update on that. We recently received 30% design drawings, and so we're looking through that, and it's really exciting what they've come up with some significant improvements at Pacific City. So with that, I would request that you approve this contract with Camp Creek for the electrical engineering work.
Okay, thank you. Commissioners, questions, comments?
I'm just terrific. I'm glad it's moving forward.
As do I. Our transfer stations in Tillamook County are a busy place. People going in and out all the time, doing a lot of recycling, things of that nature. So it's really important, David. I'm so glad you've taken it upon yourself to try to find ways to improve services, especially at the Manzanita and Pacific City transfer stations. This is work that I think is going to pay dividends, and I appreciate very much everything you're doing here.
And I would agree with my fellow commissioners. This is exciting. You know, we have had some fairly lengthy conversations about the need for this work and the sort of steps and stages we've taken to get here. And I'm excited to see, as you are, the bids that come back and what that looks like. So I think we're ready for a motion.
Madam Chair, in consideration of a professional services agreement with Camp Creek Electric for electric design and engineering for Pacific City Transfer Station, I would move approval.
We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Thank you. Thank you
Thanks,
so
David.
much, David.
Thank you. And if I could impose on just for a minute of your time and use this platform for, I guess, public service announcement. The construction began this week on the Manzanita transfer station improvements. And that means there's heavy equipment on site and things are moving around. Things look different. I was just up there this morning. Things look very differently than they did just 48 hours ago. And we put out a statement to everybody, letting them know we have taken steps to make sure that services are either not impacted at all or the impacts will be very minimal. And my request is just that people, when they're traveling up there, when they're going around, when they're passing through the transfer station, they be cognizant of there is construction going on there, and don't stop and try to walk around and look and see, that really neat yellow machine that moves back and forth like this, weighs a lot, does a lot of very serious work, and it's heavy. There's a reason those people operating are wearing hard hats. And it is a construction site, so please keep your distance, stay safe, observe from a distance, and rest assured that by the time we get around to spring, they should be done.
Wonderful, thank you.
Thank you.
Yes. Commissioner Bob.
So, Dave, you've probably already done this, but if you haven't, please consider putting up a note on North County News on Facebook and also on the BBQ.
Yep, it went out this weekend.
Terrific, thank you.
Perfect, thank you.
Thank-
All right, thank you so much.
Thank you.
All right, so we have postponed item 12, so we will move on to item 13, which is tied along to items, I think pretty much the rest of it. We have one on our agenda that's not a part of that. So we have, we'll start with number 13, discussion and consideration of a revised AFSCME pay table effective January 1, 2023. And we have Sean Blanchard, our treasurer, with us this morning.
Good morning, Commissioners. In response to inflation, wages, our employees who we value a lot, you made the decision to do a 5% increase across the board. We executed an MOU with AFSCME, and this is to adopt the pay table effective January 1, 2023, with a 5% increase.
Okay, thank you. Commissioner Bell, questions, comments?
I am happy that this is going into effect, and I appreciate your work on it. I know it was a lot of work to revise the pay table, so thank you.
Now we concur, and I don't think we need to make these statements for all of the next several items that you're going to be talking about, but inflation has hit our employees very hard. Our employees are the best asset, the biggest asset that we have in Tillamook County. We cannot run this county without our employees. They deserve to be paid a living wage. This 5% increase issue of an 8 to 9% inflation rate that we're looking at currently. Hopefully it's not gonna go up from here, but it's something that we felt we had to do. Just make sure that people are able to put food on the table and clothes on their backs. So I'm in full support of all of these, and we're gonna be discussing several of them coming up, so I won't have to make all these comments over and over and over again. Sean, thank you for what you do. Thank you for finding the money for this. It's vitally important that we keep and maintain a lively, healthy staff for Tillamook County. And we've got, what, 250 employees currently, and we're understaffed because it's difficult for us to hire new employees. So, you know, this is not only going to help our current employees, but perhaps help in recruiting additional employees for the county that we've been short for many years now. So, thank you for what you're doing, Sean.
Yep. No, I thank my staff and thank everybody else that helped, HR Director Jody Wilson, Aaron Frost, and everybody who has helped through all this whole thing.
Don't forget the commissioners.
Well, okay, commissioners too, they gave a good one.
Thank you, Sean, I appreciate it, and I'm surprised David didn't ask this question, so I will ask the difficult question, which is, you know, how are we able to afford this? You know, we know that we talk often about the county and our challenges financially, so can you talk a little bit about just where we are currently financially and how we're able to afford this at this time?
Didn't bring my spreadsheet. A big part of it is we're unable to fill out open positions. Like a lot of people, we're hiring outside and we're not getting applicants in. People are either happy where they're at, so they're not wanting to leave, or they're just not wanting to work. I don't know the reason why, but that is a big reason as to why we're able to afford this. So down the road, this may cost us those open positions that we may not be able to refill, but we'll be able to keep and retain the employees at a higher wage and hopefully find other efficiencies either through software or departmental look-throughs as to how things are operating within a department.
You have to understand, and I'm hoping everyone in our audience does understand, this isn't just Tillamook County or Oregon. It's nationwide. We don't know where all the people that used to work went. I ask that question constantly, and people just throw up their hands and they don't know where all these people went and what they're doing. It's kind of mind-boggling.
Actually, they know quite a bit, David. Would you like me? I will share a little bit. I will share a little bit.
I was asking the wrong people.
You were asking the wrong people. So one of the things that is wonderful is the opportunity on Colpac, which is our economic development district. We hear each quarter from, or I guess we meet every other month, from the Oregon Employment Department. And they share with us sort of what are the trends in employment and what are they learning. And I think what's been interesting during the pandemic is that, yes, we have a lot of folks leave the workforce. And they've done a lot of work to figure out who left the workforce, where they went, and where are they now. That's an important part of the work they do. So we know that during the pandemic, a lot of families had to have one of their two wage earners stay home. It's just their school was not in session, childcare, daycares were not functioning, things just sort of stopped for how we normally cared for our children. And with that being the case, many of those families learned that they could actually survive without that second parent working. And in fact, the value, we talk a lot about quality of life and people through the pandemic reevaluating their quality of life. And so a large percentage of the folks that stopped working were in fact the mothers, which is not surprising. There are also some fathers who stopped working, but overall those in that category that are not returning to the workforce are women. And so a percentage of them are staying home because it provides stable childcare and stable support for their kids. Because even now, if you test positive for COVID, you stay home, right? So it's still an issue. And so that's part of our workforce that hasn't returned, and that has been largely females. The other thing that has happened, which is not unexpected, but we haven't talked about it a lot, was the retirement of the baby boomers. We've known for a long time that that is the largest, generation that we have are the boomers, and they are achieving retirement age. And again, with the pandemic and the choice of quality of life, many of them said, I'm just done, and they're not coming back. So that is another fairly sizable slice of who's left the workforce. And then the third thing that they've talked about are those who have started their own businesses. We have self-employment is up. People who worked from home and realized, this is something I could do for myself. I don't actually have to have that employer. I don't actually have to go to an office every day. They still want me to do what I do. I'll do it as a self-employed contractor. And so those numbers went up as well. So that's the largest slice of people who left the workforce. They are now starting to see a bit of a return from those who started their own businesses. Some of those folks are coming back to the workforce as employees, and you know, the thinking is that perhaps after going through a year of that, filing taxes, doing the work that you have to do, all of you who are self-employed out there know it's not quite as simple as it looks, and you do owe funds to the federal government for your taxes, so you have to make sure you're doing that work. And so, I mean, there's a slice of those folks who are now returning to the workforce. So it is our hope as well that more will continue to return. But the conversation that people are just staying home and getting paid by the government is no longer a valid conversation, if you will. Those folks, at this point, our unemployment is exceptionally low, and the number of people on unemployment, I think in Tillamook County, it was under 500 people the last time that I looked at that number. So, sorry to sidetrack, but you know, I hear so often that people don't know, and I think, oh my gosh, I've not shared this widely enough.
And I was just asking the wrong question. I should have asked you in the beginning, except we can't talk.
I know, right? So now we can. There you go. Sorry everyone out there for that whole sidetrack, but I think it's an interesting conversation we're all having.
It is interesting, and there's another group that you kind of mentioned that I'd like to build on. Among the unemployed, my son graduated from college early in the pandemic, and he couldn't get a job in his field because it was early in the pandemic and businesses were not hiring new people who would need to be trained, who would come in person. Some businesses were hiring experienced people to work remotely, but not brand new, freshly minted grads. So in the meantime, he taught himself day trading, and so he's working from home. He's making a living. He's successful. He's not unemployed. He's not on anybody's list. Nobody is measuring this group of young professionals who are working for themselves now. But it's not only him; it's a whole bunch of his friends. There's a whole group of people who are young professionals who never entered the workplace.
Oh, interesting.
It is.
Yeah. Yeah.
Mm.
Yeah, so there are a lot of folks out there and they're doing well. I think that's the key piece, right? Is that it's folks who are able to meet their needs through means other than an employer relationship.
But getting back to Sean.
Yes, so sorry, Sean, again. Thank you for indulging us.
So I wanted to mention that when Sean explained in a previous meeting that part of the way that we're paying for this is through the positions we haven't been able to fill that we've been talking about. But it's specifically because when we budget for those positions, we set aside the money in the budget for their benefits. And the benefits are what, 35% or more of or more of salary. So even if we fill those positions later, we have set aside the 35% or more of their salary for benefits. So and that money is accumulating in the budget. So that money is available. We're transitioning that money now to be able to pay our current employees 5% more to appreciate and retain them, and I think what I've heard people talk about with concern is, well, if we're spending the money from these unfilled positions, does that mean we'll never be able to fill them? And it may mean that ultimately, but not necessarily, because what we're really spending is the unspent benefit money.
Retirement health insurance.
Right. It's actually 45%.
It's closer to 45-ish,
Yeah, the 35% I think is retirement. So, definitely there are some pieces. And I will say that one of the other things that we're doing this year when we do our budgets with our department heads is we're sitting down and we're digging deeper. The process in the past is that a department head creates a budget, they discuss it with their liaison, and they bring it to the budget committee. And the questions are all asked there, which is a limited time window. With our budget committee, we've added an additional meeting sitting down with liaison and the treasurer to dig a little deeper into budgets, because we want to make sure that our budgeting is as accurate as it can be and is as reasonable as it can be. Because if we are ending up at the end of the year with funds that are budgeted but unspent, we need to make sure we understand why that is, what's happening, or if we are ending up with budgets where they're overspent, because there's something that absolutely must happen that we don't have a choice about. So again, we're gonna dig a little deeper with this important. The county is looking at revenue as a challenge into the future, and the most important thing we can do right now is make sure we are being as efficient and effective and accurate as possible so we can plan for the future. So, another side trail, thank you. So many of those we could go down. So, any other questions for Sean specifically related to this particular pay table before we entertain a motion? Okay.
Madam Chair, in consideration of a revised Ask-Me pay table effective January 1, 2023, I would move.
I second. We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Thank you. Item 14, discussion and consideration of a revised AFSCME Union Behavioral Health Pay Table effective January 1, 2023.
Before you is a revised AFSCME behavioral health pay table. These are union employees, however, they are exempt. So that is why they are on their separate pay table.
Pay table.
Yes.
And there's two of them. Okay, perfect.
Okay, I don't think we need to revisit the entire conversation. Is there anything specific to this pay table?
You don't want to revisit the entire conversation?
Well, we could. How long do you want to be here today?
No, just kidding.
Okay, if there are no questions specific to this table, I think we're ready to entertain a motion.
Ready for a motion. Madam Chair, in consideration of a revised AFSCME Union Behavioral Health Pay Table effective January 1, 2023, I would move approval.
I second. We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Vote aye. Motion carries. Okay. Moving on to number 15, discussion and consideration of a revised AFSCME Union Information Services Pay Table effective January 1.
Again, the difference in this one, they are union represented employees, however, they are exempt. So that's why they are on their separate pay table.
In the IS department. Perfect.
Okay. Any questions specific to this pay table?
Ready for a motion.
Ready for motion.
Madam Chair, in consideration of a revised AFSCME Union Information Services Pay Table effective January 1, 2023, I would move approval.
I second. Any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Thank you. Item number 16, discussion and consideration of a revised part-time temporary pay table effective January 1.
So this one also incorporates the 5% increase. It's usually the last one or the one that gets left off and it's, I caught it this time. So it's before you along with all the 8 others.
Okay, thank you. Any questions specific to this pay table? No. I think we're ready for a motion.
Madam Chair, in consideration of a revised part-time temporary pay table effective January 1, 2023, I would move approval.
We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Thank you. Item number 17, discussion and consideration of a revised executive service pay table effective January 1, 2023.
So again, this reflects the 5%. There were also a few range changes with the Parks Director moving from range 6 to 7. The BOC Chief of Staff from 8 to 9, and range 10 was added for the Health and Human Services Administrator and Public Works Director, and that was in the recommendation. I saw Jody was there, now she's gone. The HR Director and the previous HRN. Okay. If Jody has anything to say, I welcome her input.
Jody, do you have any comments that you'd like to make in relation to this or other pay tables?
Good morning, everyone. Thank you, Sean, for moving these pay tables forward. The adjustments that we are proposing on the non-rep pay tables we're behind market in a significant manner. And so we want to continue working on the compensation study on a global basis and looking at pay equity and where we look at from a comparable character. But the increases that were proposed for the select group of classifications were due to significantly lagging the market.
Thank you, appreciate that. Okay, any other questions or comments on this paper? No. Okay,
Madam Chair, in consideration of a revised executive service pay table effective January 1, 2023, I would move approval.
a second. We have a motion and a second. Any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Moving on to item number 18, discussion and consideration of a revised health provider pay table effective January 1, 2023.
Again, this reflects the 5% adjustment. And before you to discuss and consider if you want to adopt it.
Any questions on this pay table? Okay.
I will say I did reach out to Marlene before doing this one because she has her finger on the health pay and whatnot to see if there were any other changes, and at this time she didn't have any. So.
Wonderful, thank you. Yeah, that is a challenging one as government with our healthcare providers. So, okay.
Madam Chair, in consideration of a revised health provider pay table effective January 1, 2023, I would move approval.
Second. We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Okay, number 19, discussion and consideration of a revised justice facility pay table effective January 1, 2023.
So this is for the justice facility, reflects the 5%. This includes the sergeants, lieutenants, and undersheriff.
Any questions related to this pay table?
Madam Chair, in consideration of a revised justice facility pay table effective January 1, 2023, I would move approval.
We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Item number 20, discussion and consideration of a revised Teamsters Union pay table effective January 1, 2023.
Again, an MOU with the Teamsters Union was executed, and this reflects the 5% increase.
Questions or comments on this particular pay table?
No, other than we're now talking about a separate union, different union within the county.
Yes.
Correct. There are two unions in the county, AFSCME and Teamsters, and then there are also employees of the county not covered by union node, which we refer to as non-represented. So there's a lot of categories, which is why there's a lot of pay tables. So.
Ready for a motion? Madam Chair, in consideration of a revised Teamsters Union pay table effective January 1, 2023, I would move approval.
We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Item number 21, discussion and consideration of a revised non-represented, non-exempt pay table effective January 1, 2023.
So this is for the non-rep, non-exempt pay table. There were a few range changes on it. The facility supervisor moved from range 2 to 4, the engineering project supervisor from 9 to 11, and the chief deputy treasurer assistant finance director from 12 to 13. So based on, as Jody said, market, how far below we were.
Comments or questions?
No, I'm glad we're moving forward with this.
So would Jody like to comment on this one? And I know we're changing some pay ranges, but that's because we are so behind the market in certain areas. We continue with our evaluation of pay tables and how we pay in the county. Jody, do you have any comments on this one in particular?
I think the initial study that came in, there were certain classifications that we were looking at 12% off market or above, and the recommendations that are coming through now were in excess of that 12% and in sometimes even more. So it's bringing it more in alignment and making sure that we are We're trying to catch up. We might not be able to catch it up in one fell swoop, but we wanted to bring it closer in alignment with the market.
Thank you for that, I appreciate it.
All right, thank you.
Ready for a
I
motion?
think we're ready for motion.
Madam Chair, in consideration of a revised, non-represented, non-exempt pay table effective January 1, 2023, I would move approval.
I second. We have a motion and a second. Any further discussion?
Just to say that I feel like I would be remiss in not saying that what we're voting on today represents months of work in Sean's office and in HR also, and so much work. So I'm really grateful for this work and that you got it all done, and you know, in the time that you said that you would, and so thank you.
I appreciate the help from HR Annie, from Jody, from Brianna, Mary Jo, Robin Kelly in HR, the commissioners, Rachel. I mean, everybody's. It's been a collaborative effort to get to here, and hopefully we move forward with our next step.
Yeah, agreed. This has been a long road. We have been asking for a wage study as the budget committee for quite some time, before I was even in a commissioner role, 10 years.
At least 10 for me.
10 is what Sean is sharing with us. And for a variety of reasons, it hasn't happened. And certainly COVID put the kibosh on it happening for, you know, the 2 years of COVID. And we finally said we just have to do this, and started this work with HR Annie, a consulting firm that we were working with in the absence of an HR director, having Jody come on board. She's been here, I think, 7 weeks now, maybe 8 weeks at most. And so she grabbed what they had and just really refined it, fine-tuned it so that it aligned with our work particularly well, so that we could get this done. We have known that there was likely a need, and the wage study has given us an opportunity to really sort of verify that. That report will be released, but it's not quite there yet. We are really still finalizing. It's a lot of work to determine what I'm gonna just pick one, solid waste supervisor does in Tillamook County versus what they do in Clatsop County, or if they even exist in Clatsop County, so you can come up with a comparable. We compared 12 counties. It took a lot of time and a lot of work by starting with HR Annie and finalizing with our HR department these different positions and making sure that we are looking at apples and apples. Because if you hear us say this, if you've seen one county, you've seen one county. It is not the same. And so it just takes a lot of work to get to where we need it to be. We were able to see that it was time to take a step given the inflation and the fact that we do value our employees. We cannot do what we do without our people. The majority of things that we do as a county are not, we don't make widgets. We don't have a factory here where we need to fix our mechanisms. It's people. It's people that provide services to our constituents, and it's really important to care for them. So it has been a lot of work. Thank you for bringing that up. Okay, we're ready for the motion? Or do we?
Motion in a second.
Okay, that's right. I went to more discussion, which never happens. Threw me off. We never
Never,
have more
never.
discussion.
Never.
So, finishing our more discussion, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye. Motion carries.
Thank you, commissioners.
Thank you. So I would share there is one category of our employees that are not represented in the adoption of these tables, and that is our elected officials. And I bring that up for a couple of reasons. One is that we have many elected officials here who serve as department heads. So not only are they elected by our public, they are in fact functioning as a department head. And so that research that study is also being done. And there is specifically a compensation committee, which are the 3 members of the budget committee that are not commissioners, which in this case is Doug Olson, Bill Bartline, and Michael Scott, who are the compensation committee, and they have been given the first cut at that data, had an opportunity to visit with Jody, and then they will continue their discussion as to how they feel about the electeds and their compensation, and to determine if we are in line with where we should be or not. And when I say we, that includes the commissioner, the treasurer, the assessor, the sheriff, the clerk. So that is a conversation that is still happening. And it's an important conversation because our electeds, again, we work We oversee departments. We are not the same, for instance, as Clatsop County, where they work very hard, but they don't oversee departments. They have a different structure. And whereas we are full-time employees to the county. So that one, I'm sure will come. The compensation committee will be having conversation, and that will be a public meeting. So if that's something that's of interest, you keep your eye on our calendars for that. I don't know when the next discussion is. Okay. Okay, we are ready to move on to item number 22, which is discussion and consideration of an order in the matter of directing the sheriff to advertise and sell certain properties. Rachel Haggerty, Chief of Staff.
Good morning. If this seems like deja vu, it is because it is. I presented this exact order, with the exception of a change in the auction date, to you on December 14th. You approved it. We discussed the 20 properties that the sheriff will be presenting for auction on January 31st. Staff then ensued with the noticing protocols, 4 weeks consecutive noticing in the Headlight Herald. The first run with the Headlight Herald wasn't in error, and so that triggers the need to present this order to you again, adjusting the auction date. So nothing has changed except for the auction date is being rescheduled from January 31st to February 13th. So this order also repeals Order 22-0669.
Okay. Right, thank you. Questions or concerns?
No, because we have approved it previously. I think that we're just changing the date.
And go back over again, so these are 20 county-owned properties at this point, ranging in market value from $1,000 up to what, $348. So an opportunity for anyone out there that if you look at these properties and feel one might serve your purposes for things you may want to do in the future, perfect opportunity to pick up some county-owned property, oftentimes at a lesser price than true market value. So just want to bring that up to people.
Perfect, thank you. And we've had this discussion previously as well, that we vet those properties for whether or not they could be useful in our development of workforce or affordable housing before we put them on this list. And unfortunately, none of those properties really fit the bill for what we need, so they will go for sale. Okay, I think we're ready.
Madam Chair, on the matter of directing the sheriff to advertise and sell certain properties, order number 23-006, I would move approval.
I second.
We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Thank you. Okay, board concerns. Do we have any board concerns today? Okay, I think that we are going to adjourn into an executive session. So before we do that, I will take the opportunity to read our other meetings and announcements, as we do not expect to make decisions when we return to the meeting, so you don't necessarily feel like you want to hang out and see when we come back. So the commissioners will hold a board briefing on Wednesday, January 11, 2023 at 2 p.m. to discuss weekly commissioner updates. The meeting will be held in the Board of Commissioners Meeting Room 106 in the Tillamook County Courthouse, 201 Laurel Avenue, Tillamook, Oregon. The teleconference number is 1-971-254-3149, conference ID 736-023-979#. The Commissioners will hold an executive session on Friday, January 13, 2023 at 9 a.m. pursuant to ORS 192.660 sub 2 sub I to conduct a performance evaluation. The executive session will be held at the courthouse in the Board of Commissioners Meeting Room 106, 201 Laurel Avenue, Tillamook, Oregon. The executive session is not open to the public. Martin Luther King Jr. Day is an observed holiday for the county and Oregon State Circuit Court. All county offices in the Tillamook County Courthouse and the Tillamook County Library, administrative offices in the jail and the Justice Facility, Public Works Department, Department of Community Development, Surveyor's Office, and the Health and Human Services Department and clinics, and the State Circuit Court will be closed on Monday, January 16, 2023. The Commissioners will hold an executive session on Thursday, January 19, 2023 at 9 a.m. pursuant to ORS 192.660 sub 2 sub I to conduct a performance evaluation. The executive session will be held at the courthouse in the Board of Commissioners Meeting Room number 106, 201 Laurel Avenue, Tillamook, Oregon. The executive session is not open to the public. Phil, would you like to give us the ORS under which we are going into executive session?
926602D.
Okay, with that, we will recess the Board of Commissioners.